Hi, so today I'm gonna change wound dressing on my patient. So what I need is I need 3 gauzes and 1 ADP pack, and I need a pair of sterile gloves, and I need a ruler and a pen, and I need a Q-tip. This is already used, and I need normal saline and sanitizer and some clean gloves. So in my patient's room, I will check the environment. So the room is safe and the bed is plugged and is in low position. And I just adjust it to my working height. And I identify the patient by 2 identifiers, and I will confirm that in MAR and in wristband. And I will ask the patient if he has any questions before I start. And I will also use proper body mechanics and proper personal protective equipment. So first, what I need to do is I need to remove the old dressing and assess the wound site. So I will clean
Yeah, that's just, just keeping the sterility intact.
So for removing the old dressing, I need to be very gentle, not irritating the patient's skin. So I will grab tape by one hand and one skin by the other hand, and I will gently remove the tape. Not irritating the patient's skin. And then I will assess the wound drainage for odor, color, and amount if there is any.
Do we ever sign out of this one?
And I check the same thing for the other part, the rest of the old dressing too. So I will document the findings in my MAR later on after finishing the procedure, and then I will discard this set of clean gloves. Hand hygiene. So now I need to assess the wound site. So I will use creased acronym.
I know, but I want to get it out of the way when it's fresh in your head.
So
Oh, I know. Yeah.
I don't see any sutures or staples on the wound, and I don't see any redness around the skin. And I don't see any edema, but I make sure to palpate it, and there isn't any edema. And for size, I need to measure and document that. So I'm gonna use a ruler. So for length, it's about 10 centimeters in length. And it's about 2.2 centimeter in width. For the depth, I need to use the Q-tip, a sterile one. So I open and just remove one Q-tip. And in the center of the wound, I just measure it by marking like where the wound meets the skin. And then I measure it right here. It's about 1 centimeter in depth. So I discard that, and I remove my gloves too. So I don't see any. Well, actually, before removing my gloves, I will just continue with my crease first, so I don't see any ecchymosis on the surrounding skin. And for drainage, I already checked the oil dressing for drainage, but I will also check the any like remaining drainage on the wound itself, and I don't note any. So now I need to put my clean, like new dressing to the wound site. So now I need to arrange my equipment. So I will carefully open the gauze pack. I will make sure I just touch the outer 1-inch border so that I keep sterility of the gauzes. I will open ADP pack as well. And I already checked the last opening of the saline, and it hasn't been more than 24 hours, so I can still use it, but I will make sure to lip it before I use for this, like this one change. And now I need to put on my sterile gloves. So I already checked like expiration dates and package like intactness for all my equipment, and I also did it for my sterile gloves too, so I know it's sterile and new. So just open it. And also I will touch only by 1-inch outer border. Actually, this part has been contaminated, so in the hospital I will discard this set, and I'll call for assistance for a new set of sterile gloves. So I will start with wearing sterile gloves again, but for validation purpose I will just continue with this. So again, like I wouldn't touch outer side. And since both hands are sterile, now I can just discard it. And so my dominant hand will be sterile. So with my non-sterile hand to be, I open the bottle. Well, I shouldn't like across the sterile side, so I will go this way. Now we leave the first part, and then I carefully wet like wet the two gauzes, 2 packs of gauzes, and like if the water has floated out of the pack, I will disregard this pack and start with the new pack, new gauze pack. But for validation purpose, I will just start with this. So this is my sterile hand. So with my sterile hand, pass it to my non-sterile hand without touching it. And I will clean the surrounding tissue from 12 o'clock to 6 o'clock. And discard it. Again, with my sterile hand. I nicely adjust it. Pass it to my non-sterile hand, and from top to bottom, from the most contaminated area to the least contaminated area, I clean it. And with my sterile hand, and I make sure the part with the blue line is facing the table because it has absorbent property. And with my sterile hand, without touching the actual wound, I will just put it over the wound. Because I already cleaned the outer borders and the wound itself is sterile, so I will use my sterile hand. Just put the gauze without touching the actual wound. And this is wet gauze, so I will put it over the dry ones. And again, like, I make sure there isn't no water floated, and if it did, I will just change the gauzes and restart with the new equipment or the procedure. And then now I can grab the ADV bag only for the outer side and then put it over here. And now I'm gonna just remove my sterile gloves because now I need to tape my wound and it is easier without wearing gloves. So, but I make sure that I wash my hands, and then I will window tape it. I'm kind of measuring it because, like, I don't want to use too much extra tape over the patient's skin. And the next thing is I need to document the date and time and my initial over the wound, wound dressing. So just put it over the wound site. And I perform hand hygiene. I will ask the patient if he has any discomfort, pain, or any questions before I leave. And then I check the room safety, and I will adjust the bed to the low position, and then I can leave the room.